Good morning, and today I'm going to be explaining to you the root canal procedure. And so, one of the main reasons why a patient would need a root canal is for extensive decay, and it's decay that doesn't just go into the dentin and the enamel, but actually goes into the pulp of the tooth. And so sometimes when decay goes into the tooth, it causes an infection and sometimes causes an abscess to grow. And so sometimes that's actually how we know that a patient needs a root canal, because on their x-ray, when we take their x-ray, there's going to be kind of like a dark circle at the tip of the root at their apex. And that's how we know a patient will need a root canal. So first, for our procedure, we're going to go ahead and see their patient. We're going to look over their health history, make sure they're able to take the local anesthetic, just in case they don't need, or they need an anesthetic without epinephrine. Other allergies as well. And then we have to explain the procedure to our patient so they understand what's going on. And then once all their questions are answered, or if they have any concerns, we can go ahead and give them a consent form to sign. And once that consent form is signed, we can go ahead and start our procedure. So we're first going to make sure that our patient has an x-ray up to date, a periapical x-ray. And if they do, then that's fine. If they don't, go ahead and take an x-ray. And then we're going to administer a local anesthetic, which includes our cartridge, our needle, and then our syringe, which looks like this. That's the little setup. And then once the patient can feel the anesthetic, we're gonna go ahead and place the rubber dam to isolate that tooth that we're going to be working on, which looks like this. And it comes with the dental dam, the clamp, the frame, and then the scissors. So when we put it on the patient, this is what it should look like. Right here, down here. And then the actual first step is the doctor's gonna need it to access the preparation. So the doctor's gonna use an endodontic explorer, which looks like this. And this is the first instrument that is going to be used. And like I said, this is used to gain entry into the canals. It is sharp and thin, so it's pretty easy for the doctor to use to locate the canal. And then the second step, we're going to go ahead and the doctor will use a K-type file, which is an endodontic file, which looks like this. And this is used to locate, clean, and shape the canals. This is actually the most time-consuming step. And the K-type file helps widen the canal, so the doctor can go ahead and access like the pulp and stuff. And then we can also use RC prep, which looks like this in a second. The RC prep is actually used to lubricate the files, so when the doctor goes into the canal, it's not dry, so it doesn't irritate the canal. So the RC prep looks like this. Looks like that. And like I said, it is used to lubricate the canals. And then if necessary, we're going to use a barbed brooch. This is used to get out like the necrotic pulp and stuff from the canal. It looks like this. It almost looks like barbed wire, like around. These are like little sharp. They're kind of like sharp like fish hooks. And it removes, it just helps remove the necrotic pulp. And then most of the time the pulp will come out in pieces. It won't come out as like a full like the full pulp. And then after this, we're gonna go ahead and make sure that we're constantly irrigating the canal with an irrigation syringe. We can use hypochlorite, which is bleach, or hydrogen peroxide, and it's just a regular irrigation syringe, just making sure that we are cleaning the canal so dentin doesn't build up. This helps stops bleeding, and this also does help disinfect the canal. And when that is done, the doctor will use the Gates Glidden to enlarge the walls of the pulp chamber and to help open the canal more. And this Gates Glidden is used on a contra angle. And then the doctor will also use reamer files, which look like this. Which looks like this. And that is also used to help widen the canal. The reamer files is similar to the K-type files, except the spirals are further apart to help the doctor go in there and remove the dentin. And then when that is done, the doctor is going to go in with the gutta percha, the master point. And this is a natural rubber used to fill the canal. And it's the same size as the K-type files. And so the doctor's going to go ahead and put the gutta percha into the canal. He's going to make sure that it's the right size for the canal. And sometimes the doctor will have us, he would put the gutta percha in, and then he'll have us take an x-ray to make sure that they do fit in the canal, just in case they're too small or they're too large. And then once the doctor is done and he has the right size for the gutta percha, he's going to take the gutta percha out, and then he's going to dry the canal with paper points. They actually are the shape of gutta percha, so they absorb the water in the canal good. And these are what paper points look like. And they're just tightly rolled up, like cotton points. And like I said, they're almost the shape of the canal, so it just helps the doctor go ahead in there and dry them. If the doctor doesn't dry the canals correctly, the tooth can actually is in risk of being reinfected or having a reinfection. And then if moisture is left, there actually might be bacteria present, which will then lead to having another infection. In these next couple steps, we're going to start filling the canal. So the first step in those steps, we're going to heat the Glick instrument, the Glick 1 instrument, with an alcohol torch. And this is going to help almost kind of like heat the Glick. So when we go in and we condense the gutta percha, the doctor, it almost like melts the rubber. So first, this is what the alcohol torch looks like. Nothing crazy like a big regular torch, just a regular small alcohol torch. And then when the Glick is all nice and heated up, we're going to start condensing the gutta percha. So I'm going to show you again what the gutta percha looks like. This is it. And then this is it inside of the tooth, but not yet heated and then like kind of scooped away. So the plugger or regular condenser can be used to condense the gutta percha into the canal. This looks like this. It has kind of like a flat tip, so it helps really condense it in there. And then next, we're going to place a temporary restoration over the gutta percha, which looks like this. And we're going to use Cavit with cotton pallets to look like this. And then when that is done, we're going to take a final x-ray, another periapical x-ray, for a couple reasons. So one of them, the insurance company that the customer is under might want proof of what they're doing, or just to see that they actually did need the root canal. Also to check the gutta percha filling. The gutta percha should not be jammed all the way to the apex of the tooth. There should be like a little room at the bottom. And then just to compare the new x-ray to the old x-ray and to see how the patient is going to heal. And so when that's done, we're going to dismiss our patient, and we're going to set them up for the next appointment, which will be their final restoration, either a filling, either a filling or a crown will be placed. And then we are going to give our patient post-operative instructions. You can say it to them, and then you can also give them a hard copy just in case they do forget. So the post-operative instructions: avoid eating anything too hard or kind of chewy or gummy on that side. The gums and that area are going to be a little swollen and then uncomfortable. We did place a dental dam, so the gums are going to be naturally just swollen. But if there's too much pain or too much throbbing and swelling, the patient needs to call the doctor ASAP. Soreness, like I said, is normal, and a little bit of the swollen gums is normal as well. But when it's very inflamed, there can be something going on, so the patient just needs to check out. The last instruction is for the patient to come back 7 to 10 days after their temporary restoration was filled for their permanent restoration. And just to kind of give you like how the tooth should look, this is what the tooth should look like. So this part is the root canal filled with the gutta percha and the adhesive cement. And then this top part is the cement and then the temporarily filling right there. And so when the patient comes back, the patient will either get a permanent filling or they'll just get a crown. Thank you.